Hi everybody, Coach Mike here, M Factor Fitness. We're going to talk about how to roll and how to smash the calves properly. So if you have foot pain, if you have Achilles pain right here, maybe pain in the back of the knee, tight hamstrings, tight calves, this is a technique you really want to pay attention to and you want to try for a while and see if you can get some relief. Because let's start with this. In the normal body, you have the bone, you have muscle, you have the fascia or fascia that covers the muscle, keeps it in place. You have some fat and you have some skin on top. And in a perfect world, all those surfaces will slide, kind of like on your bike. You know, you've got the brake cables that are in the black plastic, but the metal inside slides to pull up and down on the brakes. Same concept. So in a normally functioning calf, you should be able to press in here and it shouldn't hurt. Everything should have enough give in there that everything, it's a sign that everything is healthy. If not, we need to poke around and we need to see what's going on. So, couple tools. The traditional foam roller, sometimes you put this under here. You've all seen these videos on YouTube and stuff. Most of the time, they just are not going to find or dig deep enough to really reveal what's going on. So if you have it, sometimes it works. It's always good to get a little bit more aggressive. We got a little knobby here, a little blue knobby. And what I like to do is, if you can see on the side here, to get a little bit more, I'll lift myself up off the air, in the air, get a little bit more pressure on there, see if I can find something. And if you find a spot that hurts, start wiggling the toes around, start doing some ankle movements, kind of saw back and forth, because that's a muscle knot. We need to get that thing relaxed. Now the thing you don't want to do is curse me and grimace and make that pain face, and just, because all it's going to do is you're going to be fighting yourself on this. So if you find this spot, tack it down. This is what we call smashing. Stay on it about a minute or two, move around on it, but don't stray from that spot. And that should help break things up. Sometimes you can use a softball, and you can do this manually here. If you can see here, I'm going to take this. I'm using my palm. I'm pressing in. And I'm looking for spots, and if I find it, I'm going to really just kind of get on it and put a little circular motion on it. This is where, you'll find the lacrosse balls are actually very good because they can pinpoint the areas a little bit better. So if you find it, like I've got a little something there, I can really put the palm down and really pinpoint where that goes. And then of course you have golf ball, which sometimes, especially along the shin here, is a good way to kind of explore those areas. And it's a little harder than the lacrosse ball, pinpoints it a little bit more. So that's an option for you. The best option that I found, and hopefully you have one of these around the house. If not, why not? Get a nice big old kettlebell. Can you guys see that? I'm having trouble seeing if it's in the camera. Let me move it back a little bit. Get a nice big old kettlebell and start low, work your way up. Notice how I'm kind of going in, exploring the outside, looking around, trying to find a spot. I'm about to come up on one, I think. Yeah, right there's a little something. So this does a really good job of tacking that area down. Again, work the wrists, or not the wrists, the ankles, work the toes, saw back and forth. That's always a good technique. Stay on it a minute or two, and you should be good to go. So explore around, find those areas. If you find them, you need to stay on it and do this stuff at least daily, if not twice a day, until those muscle areas break up. Now, the other option you have is you can always get a deep tissue massage too, which will actually fix this faster. But the key element in all this is it's hardly ever an issue with the knee or the ankle. It's something in between. So we always want to look up, we always want to look down, we always want to find those muscle knots and break those up. So thank you for watching. Hopefully that helps.